spinal cord and the optic nerve. So if you are afflicted with MS, you have symptoms that can occur. And what are some of those symptoms? Some symptoms of MS you can see. So if someone is having gait or walking abnormalities, you can see them because they're using a cane or wheelchair or walking with a limp. But for others, you may not see them, and we call them the invincible symptoms of MS. So let's look at that. What we're seeing when someone presents is just a tip of the iceberg. But you never know what that patient may be experiencing. So for those living with MS, they may have fatigue that people may not see. But the face of MS has changed so much. Instead of people using cane, walker, and everything when we didn't have control of the disease, now people may be walking around and you may not know that they have signs of MS. But inwardly, they are having a whole lot of symptoms. Fatigue is a huge one, and this is so different from us who work 12 hours a day and we're tired. When we say fatigue, these patients are unable to even get past the afternoon hour. What are the problems with bowel and bladder? Urinary frequency, urgency. People avoid these type of gatherings because they don't know how close the bathroom is. They don't want to be looked at. Just go into the bathroom frequently. Sensitivity to heat in Texas is something that I have to deal with as a healthcare provider when my patients are presenting with that. Numbness and tingling. Imagine you're numb and tingling all the time and no one knows it. You're feeling it inside. This is very debilitating. Vision problems. This is a disease that can make people go blind. And we're saying you're unable to look at your phone and you're now dependent on others. So there are lots of changes that can occur with someone with MS. And then the next thing I want to talk about is depression, because in our community, mental health is not talked about as openly, and people really don't want to admit that they have mental health issues. But when you are dealing with a chronic disease, be it MS, be it stroke, be it lupus, rheumatoid arthritis, the toll of the disease can cause depression. And it's something that providers have to be mindful about, but also MS patients have to be open to the provider about it. And when I talk about depression, it's not walking around downcast with your face all drawn. People may be smiling, people may play it off, but some of the symptoms are they're not sleeping well, they're not eating well, they have a change concentration, so they're having difficulty processing with memory, they can't remember anything, and they're feeling of worth, so they feel hopeless and they feel worthless. And this is a disease that can take its toll. So for our community, it's important that we meet this head on, we address it, and talk about it. So what are the things that can cause depression? As I said, the disease itself. Some of the medications that we have our patients on can also cause it. The impact on the immune system. Recently with the pandemic that we had is something that we saw so frequently. And the medications we prescribe for patients. So now let's get down to really the meat of the matter tonight, this evening, is that MS in the African American population. All right? So the risk of MS to Black people is about 47%. Now, if you think about it, this was a disease that was taught in medical school, that Black people did not get MS. I'm not that old. I think I'm still young. Dr. Stevenson. But even when we were in medical school, this was a Caucasian disease. And now in the past 15 years, the incidence is way higher in Black women. Did you all hear me? The incidence, the highest incidence of MS is in Black women. when we look at who's getting diagnosed mostly over the past 5 years have been Black women. All right? So we know that studies, now that we have studies, people are getting diagnosed quickly, but the issue here now is that we do not have a whole lot of Black people in our clinical trials. So we have a whole bunch of people being diagnosed, but our medications that we are treating, where we really can't talk about it to say how effective it is, because there aren't a whole lot of people in our clinical trial. There is underrepresentation, and we need to change that. Why are we talking about MS in the Black population? Why is it important? So all of a sudden we have this disease that we now recognize occurring in the Black population, but the disease is quite different compared to the Caucasian population. People who are affected with this disease, we're looking at the statistics, and we see that Black people are more likely to start using a cane or assisted device for walking compared to their Caucasian counterpart. We know that they have more optic nerve involvement, so blindness or vision impairment is huge. And the spinal cord is involved over 131% compared to Caucasian population. So that means when your spinal cord is affected, you are dealing more with walking issues, with dexterity issues, all of those things that limit mobility, and we look at definition for disability. And what about this disease? Black people tend to be admitted to nursing home way earlier than the Caucasian counterparts because they have so much debilitating symptoms and they are unable to take care of themselves. So that's just a highlight of what MS does to the Black population. And it's important that we keep that in mind because these numbers that I put up here, these aren't small numbers when it comes to a disease that causes a devastating effect on one lifestyle. Fortunately, we have a whole lot of good medications now that disability is not an outcome for MS anymore. Over the past 7 to 10 years, we have changed our way of thinking. If someone was diagnosed with MS in 1990, the advice was, I'm sorry, you have MS, go and apply for disability. But since the 2000, disability is not an outcome. We have less people using mobility devices. We have people living fuller lives and living longer into the 70s and the 80s. So now we don't know what to do with our patients who are 70 and 80s because we don't have any data. Now we have to study them. And that's a good problem to have because we have reduced disability rates. But we need to reduce it more in the African American population. And we need the support from the community. And we need the support. The patients need community support. So how do you build your support team? First, you have to have a team that knows the disease and can take care of the disease. So the neurologist, the primary care doctor, and the MS nurse are important. It's important to seek medical advice from people who know the disease and not just go with what's convenient for you. The second thing is you have to take care of the symptoms of MS. So if there are symptoms of walking, impaired walking or vision or weakness, you have to bring on specialists, and that includes physical therapists, that includes occupational therapists. We don't want to restart. And we want, if depression is key, bring in a mental health therapist. We should not run from mental health. And then the last thing, you need a support group. For some people, it may be a group where they are supported. For others, it may be their spiritual group, like the pastor or whatever denomination. There are people who support them spiritually. And then we have to look at the lifestyle impact. So how you eat, exercising, because comorbidities, which I'm going to talk about later, like a little later, like high blood pressure, all of that, have an impact on MS. Okay? So don't be afraid to ask for support because it is out there. There is support for medications. There is support for symptoms you're experiencing. And MS is an expensive disease. It's an expensive disease, and if you don't know where the resources are, then things can go downhill because you're not getting the support that you need. Ask for help from your doctor. What can you help me with? I'm having difficulty with this. If you're having symptoms, open up and talk to your healthcare provider. Have your family be active if you have a good relationship with their family, that is. Have them be active and don't be afraid to ask them for support. Have your friends and let them know because this disease is something that you really can't hide from. You may go for a long period of time, but it will rear its ugly head at certain points in time. So make people aware of the support that you need. Okay, and what are some of the resources that we have? Education, education, education. The patient should be educated, the support group should be educated, and the family should be educated. Now also educate yourself about your treatment plan. What plan works best for you? As I said, this is just a small part of MS in the population, and I talk about clinical trials and how the Black population is underrepresented. Well, one thing we found out when we saw that MS was happening more frequently in the Black population, that certain medications they did not respond to as well as their Caucasian counterparts. So the treatment plan has to be tailored to the Black population. And a healthy lifestyle, how you eat, exercise, decrease alcohol, no smoking, all of those things that your primary care doctor will tell you is applicable to MS as well. And all of these things I mentioned, but we have to understand that the disease is very debilitating, and then we have to meet, the patient and the doctor have to meet at a place where they can put a good plan in place for them. All right, so the goal of MS treatment is really to reduce relapses, to slow down new lesions on MRI, and to delay disability progression. And as I mentioned before, disability is not the outcome anyway because we have such great medications that have slowed that down. So most people try to shy away from starting treatment. It's important that you stay on treatment to prevent disability. All right, so now MRI, I'm going to talk a little bit about that, is how we monitor people in terms of their response to the disease and how we are doing and how we're treating them. Is the disease under control? Do we need to change therapy? We need MRIs to do that. MRIs can be expensive, so ask for support if you need it. If you have diabetes, if you had a stroke, if you had high blood pressure or high cholesterol, those need to be controlled because if they aren't, then that also affects MS. Okay? So talk to your doctor about your mental health again. And this is no coincidence that depression and mental health is mentioned in here several times because we recognize what the disease does, and also as a community, we need to be more open about it. I like the phrase, don't suffer in silence. Your team is there to help you. Okay, I talk about this a little bit, avoiding smoking, eating a well-balanced diet, limiting alcohol, and appropriate physical activity is important. Okay? And then once again, talk to your healthcare provider. This is new for most people, but for people living with it, it's also hard to go about. And it's important that you have someone you can talk to help with this. All right, so we're coming towards the end. Learn as much as you can about the disease. If this is what you are afflicted with, find a team that works for you. Make sure you have a rapport with your healthcare team. Talk to your doctor. Be able to communicate with your doctor openly. Do not be afraid that. And then identify people who can help you in your life outside of your healthcare team. Find a treatment plan that works with you because, as I said, disability is so not an outcome anymore. And then pay attention to your overall health and your state of mind. Maintain a healthy lifestyle. That's important because it will also make you and your symptoms feel better. All right, so now I've done the doctor part. I've done an overview of MS, and hopefully you took something from this. I'm going to call on